Thank you, Mr. Chairman, and Secretary, thank you for being here today as well. And I remember a couple of weeks ago when the President had his State of the Union speech, he talked about winning the future, and the budget also that he laid out claims one of his primary budget priorities is encouraging innovation. And I couldn't agree more, coming from a state like Minnesota where we have a high industry in medical device technology, for instance, which is very, very critical for jobs, critical for health care and innovation that's there. And knowing that that's the message the President delivered not only at the State of the Union but also in the budget, why would we place a new $20 billion tax on medical technology products and device manufacturers? I'm very concerned about that. Why would we go? I was hoping it might be a repeal mechanism as a part of the budget, for instance, to kind of match some of the words that we heard about recently. But why would we do that new tax?
Well, I think the President believes certainly in accelerating innovation, and there's no doubt that medical innovation is a major component of that. I think the balance is that as we move forward, the medical device companies will also have access to a large pool of new customers who they don't currently serve, and that the additional costs will be balanced by amply by the additional customers in the pool of insured Americans.
Well, and I've heard that argument before, and I know that the vast majority of device procedures are not elective, that they're performed on older patients, for instance, and the majority of whom have insurance with Medicare. And in Massachusetts, which has been mentioned this morning, it's the model upon which much of the new health care law was built. There was no increase in device utilization like you suggest. And I just know that this is the device that this tax is really going to affect, I think, the competitiveness of our companies. And I tour these companies every week, and we all know the larger companies that exist, and they may be able to withstand it. But there are smaller companies that are not yet profitable, that are really working on these life-saving technologies that are going to be, I think, stifled to create new innovation. I think that is going to be a problem. And they've told me directly that they're worried about having to ship their research and development overseas. And I think this fits right into the mantra we've heard from the administration about shipping jobs overseas. So I don't know if you have any other feedback on there, but I know it is absolutely going to be a concern going forward. And I think if we eliminate this pipeline of venture capital and innovation, it's going to be very difficult, if not impossible, to get back.
Well, again, Congressman, we share your view that accelerating innovation is important. It's one of the reasons that assets to the Food and Drug Administration and some of their translational science is so critical, that they've developed a new pipeline to accelerate devices coming to market, as well as ensuring the safety of those devices. So we certainly share the balance, and think again that the additional consumers will again compensate for the modest tax increase.
All right. Well, thank you. Mr. Kind is recognized.
Thank you, Mr. Chairman. Madam Secretary, thank you for being here and for your patience, and thank you for your leadership in the implementation of the Affordable Care Act. Outside of the President, you probably have one of the most difficult yet most important jobs in this town today, and